Hello, welcome back. Today let's talk about foot care when you have diabetes. It is very important to take care of your feet when you are diabetic, because when you have diabetes and it's on a poor control, you develop something we call peripheral neuropathy, which is the damage of your nerves. Okay, and when you experience this, when you have neuropathy, it can cause numbness, tingling, also pain in your feet, which in many cases you won't be able to know when you have a wound. Okay, it also damages blood vessels, so the blood circulation will not be able to circulate very well as normal. Also, when you have diabetes, you have a low immune system that interfere with the wound healing. Okay, so it is very important to know how to take care of your wound when you are diabetic. Okay, how do we care for the feet? Yeah, as I said, we are doing foot care. How are we supposed to take care of our feet when you are diabetic? Number one, when you are cutting your nails, most of us use nail cutter. When you are diabetic, you are encouraged to avoid using the nail cutter, to avoid the accident of maybe cutting yourself, because we already know that when you have diabetes, you'll have a complication of wound healing because of the infection and also the immune system, the low immune system. So you need to avoid that, because that small wound can spread and become big wound. Okay, that can even cause you to lose your whole leg. So avoid using nail cutter. You just use a file. Okay, that is recommended. Also, when you wash your feet, make sure you dry very well, especially between your toes, to avoid issue like fungal infection that might lead to creation of wound. Okay, also, as I said, because of the numbness, most of the diabetic patients will not be able to know when they have a cut or when they have a wound or injury. So it is very advisable that you check your feet regularly, just to know if you accidentally had a wound without your notice, without your knowledge. So it's very advisable you check your feet uh, every day or regularly. Also, you need to avoid putting on high heels that can cause injury, to avoid wound. Because of the blood vessel damage that you might experience, it is encouraged that you avoid using putting on tight socks that will interfere with the circulation of blood. So put on loose socks to avoid that as well. And as I said earlier, you have to put on wear comfortable, well-fitting flat shoes, so that we avoid all these, we avoid injury that can result to creation of wound. Those are the things that you need to learn today, just foot care, which is very important. Otherwise, thank you so much. Continue following, like the video, um, share it to as many people as you can, so that people can continue learning. If you have any question, don't hesitate to reach out in the comment section. I'll be able to answer as many as I can. Thank you so much. Take care.